Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. Maybe you've been out trying and looking and applying everything that you can and reading the data, and guess what? Nothing's worked. Well, here's your opportunity. This is the place that you pick up the phone, you give me a call, and we're going to discuss the problem and show you how to do it without drugs, without surgery. Maybe for the first time something's going to work for you. 888-630-9625. Love to talk to you today. Have a lot of different things that we want to go over with you. It's one of those times where there's much in the news, and we're going to kind of hit on some of those things from, maybe steroids and factors that perpetuate cancer and so forth and so on. But you know what? I'd really like to talk to you and handle your problems. But as we get into it, let's talk about the number one thing that kind of gets to us all, and that's stress. But we're going to talk about it as far as the hormone that is the stress hormone, cortisol, and why cortisol is a killer, why it's going to eat you up, so to speak. It's going to break the body down. It's going to cause pathology and conditions within your body that you don't know sometimes where they come from, and you end up with all those things of hypertension and blood sugar problems and suppressed immunity, resistant patterns to all types of hormones. You crave carbohydrates and salts. You end up kind of sneaking into that metabolic syndrome problem and type 2 diabetes. You got this fat around your gut, your face, and your neck. You can't get it off. You know, what's libido anymore? You forgot about it years ago. You have no clue whatsoever. And then there's this thing called bone loss, osteoporosis. And by the way, it goes on. You can destroy your intestinal tract. You can't absorb anything. All has to do with how this stress pattern, producing this cortisol, this stress hormone, and the effects that it has and the responsibility throughout your entire body. So we're going to talk about that today. We're going to talk about what happens when you do simple things like support immunity and decrease your stress and work on things that actually can turn this malady around. But it's important that you understand that the dangers of cortisol are far-reaching. We talk about the triad of health. We talk about the triad as it belongs to my concept of ageless health and wellness, structural, chemical, emotional. We've told you so many times that when you're dealing with the structural components, we're dealing with all those things that you can put your hands on and its effect into the neurological pathways of the body. When we talk about chemistry, we talk about all those things that are exogenous to the system, anything that is outside in, anything that affects your biochemical pathways, the things that you eat you shouldn't, the things that you need more of, that you neglect, that you don't put in your body as frequently as you should. The exogenous xenoestrogens, those free-floating pollutions that we have in our atmosphere, the runoffs, the additives, the antibiotics, the drugs, you name it, it's affecting your body. And then the third piece is stress, emotional. And, sometimes I wonder maybe that's probably more significant than everything else, but not so much. They really are a balance, a triad, and they interact and interplay one to the other. So let's talk about that a little bit, and let's talk about how things happen. I want to remind you that you can listen to Dr. Tom Roselle live anytime that you'd like, to go back and re-listen to these programs, to update yourself, pass them on to your friends. You can do it in a couple of different ways. Go to RoselleRadio.com. You can go to YouTube, Roselle Radio on YouTube, or you can go to RoselleCare.com, and you can kind of go back and forth. RoselleCare.com is our primary website, and Roselle Radio will take you into everything. So feel free, and if there's anything that we can do for you, you can always call us at 703-698-7117 and, ask my staff to have one of my docs call you, or send me a note at RoselleCare.com, and I will answer that. October the 20th. Put the date away, because upcoming, starting May 1st, you're going to have the opportunity for early bird specials for our annual Ageless Health Seminar. It's our keynote. We're going to be rocking and rolling again this year with all kinds of amazing information. We're going to take you through the process of adapting to life in a stressful world. We're going to talk about nutrition. We're going to talk about acupuncture. We're going to talk about exercise. We're going to talk about putting the pieces together and actually give you the capacity, the tools, if you will, to turn your life around. Ageless Health October the 20th, 2012. And look, those of you who are patients and those of you who have been past attendees, in May, look for a flyer that'll come your way and use it quickly because you're going to get a significant discount if you register early. And those of you who have never been to our seminars, you can go online at rosellecare.com and you're going to see that in May and take advantage of the early bird specials, October the 20th. Let's talk about the dangers of cortisol, this crazy hormone, this stress hormone, if you will. You know, the Fifth Avenue marketing wants you to think that cortisol is one of those things that shouldn't be there. Well, the problem is it should be there, and you need to have a way of making it stay within its normal range, not too high and not too low. Bodies have to have cortisol to heal. Bodies have to have cortisol to repair their systems. If they're not there, you have a problem. But here's the other piece of that. When cortisol goes too high, it actually eats you up and begins to destroy tissue. So we have built-in mechanisms for protecting us. It's called the fight-flight system. There was a guy by the name of Dr. Hans Selye many years ago who's called the father of stress or stress adaptation. And what he laid out in front of us is that stress response patterns involve several different things, but they have to do with the body's ability to protect itself by either fighting or running away. But when it does that, when it's in a constant state of stress, whether you're running from an animal that's going to eat you, or you're getting out of the way of a car, or you're living in Washington, D.C., or any other major metropolitan area, you have constant stress. Maybe your mortgage is way too high. Maybe your credit card debt is way over the top. Maybe you have a personal relationship that is constantly combative. That's a stress pattern, and it begins to show the end product, the symptoms, if you will, of that constant, unrelenting stress. And maybe we have a whole lot of those things, as many of us do in this area. But cortisol, the stress hormone, is one that is meant to be there in short bursts to protect and to repair. But when it gets way too high, the body begins to destroy itself. It begins to break down. So we see ourselves getting into things like impaired cognitive performance. We just can't think. We're forgetting things. You know, gee, what was the name of that person? That doesn't have to do with old age necessarily. There are other reasons that happens, and one of the reasons is because of the stress. Sometimes our thyroid's not going to work. There's something called an HPA axis, and that's called hypothalamus pituitary adrenal, and that has to do with this stress pattern that we're talking about. The adrenal system, these small little glands that sit on top of your kidneys, we've talked about it many times, is the orchestrator of protection, of allowing you to live in this stressful environment. If those guys are beat up, they're not working the way they're supposed to, then many other systems, including thyroid function, are not going to work. You go to the doc and he says, well, your thyroid's not working, and he gives you Synthroid, or he gives you some other hormone that is supposed to replace the hormone that the thyroid is supposed to produce naturally, without asking the question, why is that body failing? Why is it breaking down? Why isn't the thyroid performing optimally? Well, there are many reasons for that, but when we really understand stress, we get it. We understand that things like inflammation, inflammatory reactions, blocks the ability of the thyroid to work properly. We know that there's a depletion of many different enzymes and amino acids. One of them, by the way, is something called tyrosine. Tyrosine goes into competition under stress because your adrenal glands need it too. So if the thyroid doesn't get its tyrosine, it can't make the hormone thyroxine. And if you don't have that, then it can't get into the active form and so forth, and you have a problem. We end up with bone density loss. When your stress hormone, cortisol, gets high, your body goes into an acidic pattern, and subsequently it's going to predispose to that decreased muscle tissue. If you're constantly in stress, if you're constantly in a state of fight-flight, your muscle mass degenerates. It breaks down. Even professional football teams and basketball teams and any of the professional leagues know today that they cannot push their players 2, 3, 4 days in a row at high intensity because they're going to fold. If they want them to have maximum strength, maximum endurance, they're only going to put high intensity performance about every 3 to 4 days because they need the rest period. They need to go into more adaptive patterns of training. Otherwise, when they get out in the field or on the court or on the ice or whatever they're doing, they're not going to perform at the level they should. A very dear friend of mine, a guy by the name of Dr. Evan Mladenoff out of Kansas City. Evan wrote a book, Stressed Out, Headed for Burnout, several years ago, and it's a great treatise on really what happens if you have the opportunity. We have it in our office, by the way, if you would like to purchase, or if you can't find it on Google or whatever. But it takes you through step by step what happens when stress occurs and the breakdown, and what ultimately that you can't move, you can't function. Your blood pressure is going to sneak up. Your immune system and inflammatory responses in the body are going to be altered. They're going to be compromised. You're going to see very slow wound healing. You normally said, I used to heal quickly. That cut has been there for a month or 2 months or 3 months, and it just hasn't. That's stress. That's the end product of kicking this thing in called cortisol. So we have to take this whole pattern together. Then over a period of time, what we see is something that's called metabolic syndrome, and we've talked about that repeatedly on this program. Metabolic syndrome simply is this. You start seeing blood pressure start sneaking up. You start seeing blood sugar start sneaking up. You see lipids, your blood fats, start sneaking up. And over a period of time, pretty soon they hit a critical mass, and now you got a major problem. Everything starts going the other way, meaning it starts going to eat you up. So let's talk about that for a while. Let's see what we can do to change the effect in your body, because we're all living under stress. Some of us a whole lot more than others. Some of us need to really understand that if you keep this stuff up, you're not going to have the years that you were blessed to have, and the body starts going down the tubes. 888-630-9625, 888-630 WMAL. Love to talk to you on this subject or anything else that you have in mind. If you have blood pressure problems, or you're hurting all over, if you're in constant pain, this is your opportunity. Let's see what we can do to change it, and to put a little link into your life that is repeatable, that you can control virtually everything that's going on. Chronic stress means that we are constantly in a state of trying to kick in our cortisol, because we have to have that to protect everything that's going on. Where levels of the stress hormone are so high and so constantly affecting our bodies, they never have a chance to back down to normal. Two things happen. One, it's destroying you, and the second one is that pretty soon it's going to fail to produce any cortisol whatsoever. When you fail to produce any cortisol, then remember what I said earlier, you can't fix anything. The effects of chronic cortisol elevation is totally devastating the body, but the results are simply this. Your blood sugars are going to go up. You're going to get loss of calcium. You're going to get depressed. You're not going to be able to think. Your body's going to accumulate fat. You're going to lose muscle mass. And as I said, not only not able to think and bring thought processes together properly, but you're going to have memory loss, meaning that you can't reach back and re-stimulate what you're supposed to do. So if you ever have seen someone who's in chronic steroid therapy, where they've been on drugs for a long period of time, you're going to see these effects because they're similar. And that's one of the things I want to get into. We know that somebody's been on steroids forever, their calcium levels are down around their toes. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm in studio, 888-630-9625. That's 888-630 WMAL. Love to talk to you on this kind of rainy Washington dreary day, but guess what? There's sunshine in our hearts, and we can turn anything around that may be going on with you, at least make it a whole lot better. Want to go to the phones. We're talking about cortisol and stress adaptation. If we have time, we're going to talk about some other interesting things, but you're more important. Jim, how can I help you, sir?
Well, I'm actually taking a thyroid medication because the thyroid was, low production. This goes back about a year and a half ago.
Okay.
So I was doing research as a general practitioner, but who prescribed it. But I was doing some research. I haven't been having a hard time finding out, what is contributing to the low production? What is that related to? I mean, the only thing that's changed in my life, significantly, is probably about 3 years ago. I got a much more stressful job in terms of just responsibilities, et cetera. So I think that's common. Of course, I had a child.
Jim, how old are you?
I am 44.
Okay. Overweight, underweight, or on weight?
No, I'm on weight.
Okay, so let me put it to you this way, and I can only be general because I don't know a lot about you. First of all, what kind of medication are you taking? You taking Synthroid, or you taking something else? That's
like a Levoxol.
Taking Levoxol?
Something like that. It's like a bovine hormone.
Okay. So you're either taking Armour-Thyroid, you could be taking Levoxol, you could be taking Synthroid. There are a lot of other drugs on the market. Depends on whether they're trying to up-regulate your T4, or they're trying to get your T4 to convert, or they're trying to get more T3, which is the actual active hormone in your body to be at a higher level. But here's what happens, Jim. When you're under stress of any kind, and stress is the number one thing that will shut the thyroid down, as well as eating foods that are very acidic, very inflammatory to the body. And just as a mantra, not an accusation, sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, those are all acidic, and you're eating a lot of red meat and not enough vegetables. But having said that, when you look at the thyroid, you have to look to see whether or not the thyroid itself is actually able to produce the thyroid hormone T4, thyroxine, and then whether or not the thyroxine is being converted to the active hormone, which is T3. That happens in the liver. So if you can produce the hormone, but it can't convert and get it into the active form of T3, then there could be a problem with the nutrients, or the liver's being overburdened because of things that you're eating or drinking. Coffee and alcohol and so forth will do that significantly. Tyrosine, L-tyrosine, is an amino acid that is necessary to produce thyroxine, but it has to be in combination with iodine, and it has to be in combination with trace minerals. Now, if the thyroid is able to be stimulated by TSH, we're going further back up the road, the TSH is a hormone produced by the pituitary, then it will produce T4. Now, you have to look through immune function and see if there's something called reverse T3. Reverse T3 is something that shuts down the production or inhibits the production of T3, the active hormone. Now, even to make it more complicated for you, the next piece is whether or not it's getting into the tissue, even if it's being produced. And that's a resistance pattern. If the body is resistant to the absorption of it because it's either has a competition going on for that receptor site, or there's inflammation blocking it, then it doesn't make any difference even if you're getting Synthroid, or you're getting Levoxel, or you're getting Armour, or anything like that, or Naturethroid, or any of those things. They're still not going to get in. So it's not, unfortunately, I'd have to see all your labs, and most physicians only run TSH. Some of them, if you're lucky, will run TSH T4. Guys that are on are going to run TSH, total T4, free T4, total T3, free T3, T3 uptake. Then they're going to look at those reverse patterns. They're going to look at the thyroid TPOs and so forth, which are the immune functions. That's the only way that you can really tell. And then also measure cortisol. So if I've confused you, I'm sorry, but go through your dietary patterns, see if your diet is good, look at your stress patterns, see if you're getting enough rest, making sure that you're eating at least 7 servings of vegetables a day. A serving is a half of a cup. Make sure that you're eliminating the glutens. Gluten in our society is ridiculous because thanks to Monsanto, everything has been adulterated and the gluten levels are way high, so we're starting to shut down receptor sites within the intestinal tract, and we can't produce much of anything anymore. So there's a lot of reasons. Jim, if I can help you even further, get a hold of me at rosellecare.com, and I'd love to go back and forth for you, and thank you very much for your call. I appreciate it. We're several calls, and I'm going to get to all of you. We're here at 888-630-9625. That's 888-630-WMAL. We're going to be coming up for a break pretty quickly. And we're talking about cortisol. We're talking about the body's inability to produce the hormones that it should because of this. Just talked to Jim about thyroid function. It's one of those things that goes down the tubes because of high levels of cortisol due to increased stress patterns that don't get a break. We're not sleeping, we're not eating, we're not resting, we're not doing the things that reverse that. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. I'm in studio at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. We're talking about stress patterns, and we're going to pursue that a little bit more. But meantime, let's go to the phones. Barbara, how can I help you, ma'am?
Hi.
Hi, Barbara.
I have a question. Thank you for taking my call.
Oh,
I have
you're
a
welcome.
question regarding stress reduction, and that's always the toughest piece for me to try to find an answer to. What about neurofeedback and biofeedback as management methods? Well,
neurofeedback and biofeedback work, and it teaches you how to let go of the body-accumulated stress. However, you always want to go to the source, and you always want to do things that you can begin to adapt at home. So having said that, neurofeedback, it's, you're talking about neurotherapies. There's many outfits out there. There's an outfit called Clear Mind, which helps reorganize and reestablish normal brain patterns, because one of the things that happens with any kind of stress over a period of time is that the brain, I'm going to use the term, gets scrambled. And so you end up with reactions that you have no control over. They just keep coming back. You end up with what we're going to call suppressions in the nervous system. And they can cause physical and emotional and cognitive changes that are some things that are unwanted. But you have to learn how to reprogram, if you will, and neurofeedback will help you to do that. But if you don't break the stress pattern, if you don't do things that help you learn how to deal with the things that are causing the stress to begin with, then you're going to be in a loop. And, neurofeedback, in my opinion, is a whole lot better than dealing with psychiatric care. It's a whole lot better than taking tranquilizers. It's a whole lot better. But you have to begin to put things together. So, if you're doing neurofeedback or NFT training, then you're going to see some changes, providing that you can carry over the training into your life. Now, having said that, I don't have any problem with it, so let's establish that. It's not a bad thing. There's a lot of different ways of doing that. Some are better than others. And they will definitely make a difference. And there's been a lot of studies that have established that with neurofeedback training, you can begin to get a handle on all kinds of things. It's used very well with some adults who have ADHD problems and ADD problems. The symptoms will begin to improve. But again, you still have to answer the question, why those things are there to begin with. Is it a dietary allergy? Are they brain allergies? Are they a result of environmental stress patterns? Are they a result of injury that's occurred to the skull, to the spinal system? All those things can cause the same thing. Now, let's take it the next step. My life is crazy. I'm on the road constantly. I'm teaching all the time. And most people look at me and say, are you ever going to slow down? Do you ever sleep? And the short answer is maybe. But having said that, I have to do things like Tai Chi. I do things like exercise. I try to adapt my lifestyle dietarily so I'm not getting a lot of garbage in my system. My diet's usually about 85% the way it's supposed to be. I do things. I catch myself in not so right situations, and I try to calm myself that when I get into those patterns. So if you can use the neurofeedback and adapt other things, yoga, dancing, listening to some good music, don't listen to the talking heads and the craziness that's out there right now. You'll find by making those modulations in your life that all of those pieces together can help. Does that make sense?
It does. Thank you. Don't forget prayer and meditation.
Oh, absolutely. Listen, trust me. That's like foremost in my life. Barbara, thank you for your call. I appreciate it.
Thank you.
888-630-9625, 888-630-WMAL. Love to talk to you on any subject that you have in mind. Anything that helps modulate your stress patterns in the body is something that you should use and make it part of your life. Talking about stress, and there's been a lot of research on different subjects relative to this and how to handle it, from meditation to neurofeedback therapies to exercise that you enjoy doing. But when any of those things become a stress because you have to do them, then they're antagonistic to what you're trying to accomplish. When we find a patient who we know that they're in a lot of joint pain, they are not feeling well, their blood sugars are way off, they're either way too high or they're crashing around their toenails all the time, their heart rate is unstable, they're getting atrial fibrillation. It's the pattern that we see under prolonged chronic stress. They're diabetic or they're pre-diabetic or you name it. We see all of these on a regular basis. You have to understand the symptom process relative to where they came from to begin with to be able to do anything about it. Sometimes it's plain old dietary, and then you have to support the system in the healing process with a whole lot of protein so the body can heal, and a lot of minerals that come from vegetables. You have to get the patient to find periods of time when they can shut down. So many of us go to bed at nighttime, and just before we did that, we're either arguing with somebody, we're watching something that jacks us up, we're on the computer system, we're being hyperstimulated. We have to learn how to begin to quiet and to relax and to find the gentleness, listening to some good music. don't read in bed. So many of us want to sit there and we want to read while we're in bed. Our bedrooms are less than black. We're supposed to be living in caves when we sleep at nighttime. Should be totally black. Small changes. If you did nothing else, I can give you lots of herbs. There's a herb out there right now called Rhodiola rosea, which is great adaptogenic. It's a great modulator. It's a powerful herb that can be used for anxiety and cortisol balance, and supposedly it helps longevity. But it's only a piece. There's no one thing. There's no magic bullet that changes lifestyle. You have to make sure that you change you to have anything that is going to pull through the distance, if you will. It's going to allow you to have a repair process instead of just using something as a thumb in the dike, if I can use that relationship. So take a look at what's happening around you. Take a real good inventory of what your life's like and say, have I spent time trying to find something that is going to calm me? Do I have an environment that is allowing me to sleep better? Do I have a dietary pattern that is supportive of the things? And you'd be surprised that only a few changes make huge difference. Yesterday, I spent a whole day listening to a doctor do a presentation on gluten reactions and gluten sensitivities. We are the end piece of marketing and biochemical insults, in my opinion, that have allowed our bodies to begin to be susceptible and break down. What does that mean with gluten? Well, you got Monsanto, and they have modified genetically all kinds of food substances, so now we have 10 times the amount of gluten in any of our wheat products. We talked about yesterday that we can go overseas and we can eat some of these gluten products and not have the reactions that we do here in the United States, because we process foods here differently than they do in Europe, and we can get away with it. But see what happens when we have these irritations, these toxins, these little lectins that are causing irritations throughout our bodies, and subsequently we have crossover allergies into other different foods that we're not even aware of. Sometimes we don't even eat them, and we say, how can I possibly be allergic to that? It's because they're in everything. One of the things I found out yesterday that I didn't know about, that I learned something, is that gluten often is used as a stabilizer in wine when it's processed. So even when if you have a glass of wine, you think it's a good glass of wine, you have to call the manufacturers, the wineries, and find out if they're using these things in their wines. That blew my mind. I enjoy a glass of wine occasionally, and I found out that, oh my God, and I'm very gluten sensitive. If I get gluten in my body, my intestinal system does not like me. I put on weight. I feel lousy. My eyes get dark. It goes on and on and on. So many of us react the same way, and we don't even realize where we're getting it. So you have to back off. You have to take a look. You have to find out what is the most appropriate path for you to take to change some of these things. Wilma, how can I help you?
Calling for my sister-in-law who lives in the Midwest. She has had a long-standing bout of not being able to sleep well, and I'm wondering where you would start to unravel that problem.
Big question, because I don't know a lot about her, so I can only give you guidelines, but let's talk about it from a couple different aspects. How old is she, number one?
She's 63.
Okay, and has she had any injury or trauma to her body?
I don't know about that, but I'm wondering if she can call and have a conversation with you at the office. Well, yes.
Tell her this. Tell her the best thing to do if she wants to get specific is to get a hold of me at rosellecare.com.
Yes.
And send me a note, send me an email, and I will talk to her back and forth to try to get a little data. But more importantly, what's important here, Wilma, is simply this, is that when it comes to any kind of sleeping problem, there is a reason the body will not settle down. Often it's cortisol. At nighttime, cortisol has to go down slowly to the point where our bodies begin to relax and we go into a sleep pattern. And then as we're sleeping, cortisol starts rising. It starts getting higher and higher and higher. That keeps us asleep, but it also allows the body to heal and it allows the body to repair. If cortisol's too low during the nighttime when we're trying to sleep, one, we don't sleep. Secondly, we don't heal. So we get up in the morning, and it's like we need a train to get us out of bed. If we don't have our cup of coffee, if we don't have something stimulating us, we have to sit there, and it takes us an hour or more to hatch, to get our day going. Those are all signs of cortisol depletion. And there's many reasons for that. So you would look at dietary patterns. You would look at emotional stress patterns. You would look at the body having gone through emotional trauma. For example, we know in acupuncture that the acupuncture channels are higher at different times of the day. There's 12 primary channels in traditional Chinese medicine, and they have 2-hour peaks. So when you get to those peaks, then the symptoms that are associated with those peaks are going to be the highest. At nighttime, for example, between 11 and 1 o'clock in the morning, it has to do with digestion, gallbladder. Then it goes to liver from 1 to 3. Then from 3 to 5 is the lung. So if we have something, for example, that's associated with grief, the lung meridian in Chinese acupuncture has to do with grief patterns, and sometimes if grief is unresolved, that will keep us awake at nighttime, even if we're not consciously aware of it all the time. So there's many different things there, and then you have to look at medications that can keep you awake and so forth. So we can get into sleep patterns from lack of melatonin. If cortisol isn't working, then we're not going to produce enough melatonin because the hippocampus portion of the brain is under stress, and it goes on and on. But have her get a hold of me, Wilma, and I'll be more than happy to talk to her.
And I thank you for your help.
You're more than welcome. Thank you for your call. Appreciate it very much. 888-630-9625. We're talking about stress and how it really messes up the body and actually will steal your life, will deregulate your longevity. You know, all of a sudden you find that you're getting older than what the number of years are. Your body's not working the way it's supposed to, and suddenly you buy into, well, what do I expect for my age? Not so good. Premature aging is a result of oxidative stress to the body. It breaks down cellular response. And, you know, you'll say, okay, what can I take for that? Well, what you can take for that is if you can look in any book, and they're going to give you a list of all kinds of things from, you know, vitamin C to pantothenic acid to vitamin CoQ10. We were talking about rhodiola. All those things are supposed to be enhancers. So we can go to resveratrol, which is found in grapes and wine and so forth, and that's supposed to be in vitamin E and supposed to be supportive of cellular response. But the bottom line is that if you learn to calm the system, if you learn to balance your body, if you learn to get the right foods in and you eat organic whenever possible, when you go into restaurants, and if you're on the road, for example, like I am all the time, I've got to eat at restaurants often. But I go to restaurants that have expanded menus, and I'll look, and if I see something on one, I get rid of the potatoes, and I get rid of the starches, and I ask them to put extra vegetables on things. I don't order anything that's breaded. I either ask them to broil or bake or whatever, whether it's fish. And so I do the best of the worst. I do the best I possibly can under the circumstances that I'm under, because my primary interest is keeping this machine that I'm living in active, vibrant, and full of energy, so I can do all the things I love to do, meaning helping you figure your lives out and supporting you in every way that I possibly can. See, the bottom line is where you are right now at this moment in time is simply because of all the choices that you've made, or sometimes the things that you've failed to choose. And when you really get that and you understand it, and you put in front of you your primary goal of health, then you begin to realize that health is a do-it-yourself program, and that you're the only one that really has control, that I can only be your guide, I can give you information, but virtually anything that goes on in your body is reversible. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm in studio, 888-630-WMAL, as I am every Sunday at 12 noon, bringing you the most up-to-date information that I possibly can on your health, and to do it without drugs and without surgery. This is your opportunity. And don't forget, if you'd like to talk to me off the air, you can do that very simply by going to rosellecare.com. That's ROSELLECARE.com. It takes me sometimes a little longer to get back to you, all of you, but I will, simply because there's so many of you writing, and I appreciate that, and I thank you for your kind words, but I will get back to you. Let's talk a little bit more about what we're talking about. But again, I want to remind you, October the 20th, Ageless Health 2012, learn how to live in a very stressful world. And we're going to present those topics on neurological problems. We're going to talk about nutrition. We're going to talk about acupuncture. We're going to talk about women's issues and so forth. And May 1st. Those of you who've attended and our patients are going to get flyers on it. And remember, we only have limited seating for this, so the sooner you register, the better off that you're going to be. You can go online at rosellecare.com May 1, and you're going to be able to see what you need to see and to register, and I would encourage you to do that quickly. October the 20th. We're starting early, but because we don't want you to be left behind, do that. Let's talk a little bit about combating brain aging, because that's so important to all of us, and it's really a result of stress patterns and stress due to chemistries and so forth. Neurodegeneration of the brain comes in many forms. One of the most well-known is something called Alzheimer's, and then we have Parkinson's disease. Both of these occur as a result of inflammatory conditions in the nervous system, and it couples with a very dangerous product that is pro-oxidative protein, an amyloid that triggers even more inflammation and ultimately destroys the brain tissue and the brain cells. Now, there's a lot of articles out there how to return things back to normal or at least stop the process, but more importantly, what you need to know is that you can prevent this process, even if you have some of the genetic markers that says, well, you're predisposed. Just remember, predisposition only means that under certain circumstances, if those conditions are right and you trigger it environmentally, well, you end up with the problem. But if you allow yourself a healthy lifestyle, you learn how to modulate stress, then you knock down these pro-inflammatory effects and the formation of these proteins that we talked about, and subsequently this degenerative cascade that takes place. So many of you have shunned water and you don't eat supportive things. Your diet's highly acidic. Well, you have to change that. But adaptogenic lifestyles will begin to reverse many of these things, and you need to know how to do that. That's why we're here, and you can talk to me anytime about that. I wish we had more time on this program. We always come up to the end, and I have so much more to tell you, and there's so many calls that I haven't taken, but we do our best, and we keep trying every Sunday, 12 noon. Tell your friends. Don't forget, you can go to RoselleRadio.com and re-listen to any of our programs. And if you'd like to hear something special, let me know. I'll see you next week, 12 o'clock. This is Dr. Tom Roselle.